The SwiftCare suite provides care providers the ability to connect and remotely manage their patient monitoring environments around the country, while allowing physicians and health workers to stay compliant and in line with tight regulatory and governance requirements.
Hello, everybody. Today we will be conducting an interview with one of our nominees, Kinseed. And here with us today, we have its founder, Bhusate. So Pal, can you tell us a little bit more about Kinseed?
So let me start by introducing Kinseed and our purpose in life. What Kinseed means, our answer is very simple. It's in the name, which we talk about the mission and the statement and our goals and our powers in purpose in life. Kin means relationship between people, data, ecosystem, etc. Seed is how do you seed that relationship to grow things, to grow individuals within that ecosystem. And our purpose in life is really connecting the disconnected. And our focus is healthcare. And the reason we're focusing on healthcare is because it's deeply personal to me. I know what it's like to be a mother in an intensive care environment. When my son was born with 2 holes in his heart. Now, whilst the clinical teams did an amazing job, they were crippled by the tools that they were using. And I made it my personal mission that one day when my kids were grown up and financially I was fine, I was going to go and shape that space. And our journey started with Great Ormond Street Children's Hospital, the acute transfer teams. These are teams that transport very sick patients from one location to another around the country, all year round. And their biggest challenge was that they were using paper-based system to collect and share critical data in an unstructured way. In a hospital, in intensive care unit, there are many people, clinicians supporting you, but in a mobile intensive care unit, you have maximum of 1. And what we did was that we helped them digitize that particular care pathway. Now the teams collect data digitally, they're able to share that data in a very seamless way. For me, the biggest eye-opener in all of this was that they have an electronic patient record system inside the hospital, but it doesn't support this acute care pathway. Now, if the team in the ambulance needed support from the team back at base, the only way they would do that was by picking up the phone, describing the vital sign, putting the phone down. In today's world, you and I can track our taxis, we can track our takeaways, yet clinical teams can't track patient vitals as patients are on the move. And that's a really sad state to be in. This is exactly what SwiftCare has set out to address. SwiftCare is a cloud platform of digital transformation in healthcare. It's a collection of applications similar to Microsoft Office. You have Word, PowerPoint, Excel, etc. SwiftCare is exactly that. It has Medilog, Mediview, Meditrack, a set of applications that have been designed and developed through the identification of unmet need of the clinical teams. We've really brought the clinical teams to dream to reality in terms of enabling them to collect data and gain integrated experience when they're caring for patient. And so that's what SwiftCare as a platform is.
Perfect. Can you please describe, you mentioned that Kinseed works with the clinical data. Can you please dive into how Kinseed is helping revolutionize the collection, monitoring, and the processing of such vital clinical data?
Yeah, the answer is really simple. We live in a digital and a connected world, yet even today, healthcare environment is lagging behind. As mentioned previously, the mobile acute teams were not able to collect and share and review critical data in a seamless way. To help seek advice remotely, SwiftCare has revolutionized for them to actually collect that data digitally, share that data to the remote consultant, seek feedback automatically in a seamless way so that they can focus on what's really important, the patient. Let me give you a short quote. I had a call from a deputy nurse, advanced nurse practitioner from one of the pediatric intensive care teams. And I want to read out their word to word. And her exact words were, "The Kinseed app has been amazing. It has reduced the paperwork we have had to take out on transfer. I went on 3 transfers and managed not to use any paperwork, and the system worked the whole time, resulting in accurate documentation being completed. The app also helps with confidentiality and clinical governance, which is really, really important. Being able to undertake several transfers without having to make notes on paper. The team can let me know transfer number, and I can just read the information and communicate it to the relevant person who's going to be caring for that patient, not just while the patient is being transported, but also as the patient arrives to the hospital. So that's why, for me, we really help them access the right data and work with their data.
But can we get more information about the core users of the application and how the application is used in their line of work?
Yeah. So the core currently, the SwiftCare platform is a clinical information management system and more. But the current core user of the application are those teams that are involved with caring for population, right? So we have admin teams who manage the admin aspect of the patient records. We have clinical teams with the expertise in adult, pediatric, and neonatal transfers. But then more recently, we're actually working with occupational health specialists to help them improve the health and healthcare and well-being of the population that we serve in a workplace. So our application really can be configured to fulfill any care pathways, but these are the users that are currently use the application.
Well, having covered the users, can we now dive into highlighting the value, or i.e. how the application truly helps the users?
Yeah, no, for me, that's really important, because if you can't measure and deliver impact, there is no value in doing anything. And for us, in terms of the work that we've done to date, we believe there are a number of improvements and the impact that we've created. The first one is improving operational efficiency. Now the teams can access the right data at the right time to make decisions and take actions. At the end of the day, healthcare is all about data. In fact, our everyday life is all about data. They are able to collect data digitally. That means that they don't have to think about creating paper charts, etc., because they're able to collect data and share that data securely with all those involved in. They've got a single and transparent view of the patient that they're caring for. That's really, really important. And the digital aspect is important because now they've got a huge amount of data that they can actually use that data for research purpose and improve interventions. The other is about collaboration and communication. Before, the teams were picking up the phone, getting through the switchboard, describing vital signs, putting the phone down, and then performing the intervention. Now they don't need to do that because the team that's providing care remotely is able to see what's happening. So therefore, they've improved communication both in terms of the primary care and the secondary care team. And then, as I mentioned earlier on, the rich data analytics, we've given them the ability to automate reporting and create. So every piece of data that they collect, they can slice and dice that data in the way they want to improve interventions, but more importantly, for reporting compliance and any other data analytics that they need to use to make decisions. And finally, and the most importantly, is really improving the quality and safety of care. Because at the end of the day, it's about how do we keep the patients safe and how do we improve their care. And through sharing critical data in a timely manner means that you're able to provide better care for the patient. We've reduced the handover time from team that's transporting and the teams that's receiving from 60 minutes to 30 minutes. Also the collection of rich data, as I mentioned earlier on, helps them improve research. But more importantly, more recently, the work that we're doing with University Hospital Birmingham, we've demonstrated that through remote advice and guidance from general pediatricians to GP in a surgery, that we were able to reduce 40% of the patient attending from emergency departments, so they could be cared for in their local setting. So therefore, you're improving patient experience.
That is tremendous value. That is tremendous value that you've highlighted. Can we highlight now the biggest achievements of Kinseed up to date?
Yeah, there are many, but I'll try to home in one or two. We're a small, passionate, and a very high-performing team. I salute the team members every morning I get up, and they don't see it, but I do it. We've in the last 2.5 years, we've onboarded over 50 hospitals. And that's just through word of mouth, because I don't have a business development team. It's because of the impact that we've made with clinical teams. They've actually recommended us to other teams to say, here's a great data platform that is built on modern technology that you should use it to improve your care pathway. So it's about how we've worked in partnership with the clinical teams to design and develop something that is relevant for them in terms of managing their critical data. And for me, that is the sort of the biggest, impact and achievement. And more recently, we're currently working on occupational health. We're working with an occupational health consultant to help design a modern occupational health platform called MediWorks. And that's about, it's one, caring about patient, but it's the people who are caring for those patients are burnt out. But we need the ability to give them a solution that to manage their health and well-being as well. So it's about, hence the right mission at the right time, in terms of right data, right time to make decision and take action. And for me, what we've done to date, and the fact that it's a pull from the clinical teams, I take great pride in for the whole team, really.
Thank you. Well, in continuation with the wonderful partnerships and the synergies you've created with the medical and the clinical industry overall, it would be great to highlight or hear about perhaps a success story of the usage of the Kinseed application.
So the Kinseed application is really growing. The use of it's growing every day. It's all through word of mouth. I quoted what one of the deputy lead nurse had said in terms of her feedback. But I think what's important is that I will share with you a link to a case study from Great Ormond Street in terms of what the advanced nurse practitioner had to say. And for her words were, this is like having another brain, another friend who can guide me remotely when I'm trying to provide care for the patient locally. And that for me says it all.
This technology aids us because you can have somebody else, so our consultant who isn't with us can link in remotely. They can see in real time what's happening. They can link into the monitor. And they are as another brain that adds in. They're a remote team member, essentially.
The SwiftCare suite provides care providers the ability to connect and remotely manage their patient monitoring environments around the country, while allowing physicians and health workers to stay compliant and in line with tight regulatory and governance requirements.
Essentially, it's the same as a plug and play. It is a single phone that is attached to the back of the monitor, and it doesn't remove us from the clinical situation. Our St John's technicians are able to program it. All it needs is the patient number into the monitor. It automatically links up, and from that moment on, it is connected.
Absolutely. What is the importance of having, in your own words, such an application in the context of broader medical software?
That's a really interesting question. In our personal lives, we'll use digital application to access data, bank, our order, we take out our hotel bookings, etc., with relative amount of ease. But yet, this is not the case for healthcare professionals. Even yesterday, I was on a call with a consultant who's up north, and he wanted us to make changes to the application. And I was asking him about his experience of his big monolithic electronic patient records. And he said, well, it's not easy at all. So they're having to entertain all of these silos and complex electronic patient record systems, which are built on old technology. Now, as a clinician, I just want to be able to access the right data at the right time, make decision and take actions. I don't know, I keep repeating these words, but that's a fact. So therefore, it's really important that we design and develop solutions that are fit for purpose, they're easy to use, and then they allow the teams to take control of their data. And we have our guiding principles on what we work on, our principles that underpins our platform. It's about empowering clinical teams. And the first is usability. How do we make it easy for people to use it? We've never had to train anybody, right? They just look at it, they know their care pathway, they configure their care pathway, and they use it. Composability, giving them the ability to build on the existing component, because healthcare is strapped with cash. So how do we get them to sweat the assets that they've acquired? Extensibility is, how do they configure new features? How do they connect new monitors to the platform? And for us, that's really important, to have the ability to be flexible, to in order for them to sort of collect the different data type that they want to collect, because the world changes. During COVID, they were collecting different data types. So therefore, we needed the ability to give them flexible platform so that they could collect a new data type. Scalability, our platform, because it's cloud native, it can be scaled very easily. We run on Microsoft Azure, but it can really run on any cloud platform. And the final one is really interoperability. For me, that's really important. It's about keeping data in motion. These are the terms that our CTO generally use. It's about how do we liberate data in the hands of the people that provide care in a very seamless manner. So that's why for us, having open standards to integrate into existing systems so that the clinical teams can see a single view, it's really important. So those are kind of fundamental principles of the way we deliver and work.
It is very evident hearing your answer that Kinseed, the application, was designed and the key principles were structured around the ease for patients and the value, to increase the value for the end users of the application, and to truly impact the community overall. And this leads me to my next question. You did mention that you are partnered with numerous hospitals across the United Kingdom. So if you could please describe the cooperation with the NHS and how Kinseed supports and helps the operations of the NHS.
Yeah, perfect. No, I can easily do that. I'm a beneficiary of the NHS. So our NHS is very close to my heart. And for me, it's really important that whatever we do today, that we create the right healthcare system, not just for our current generation, but more importantly, for the future generation. If we don't do that now, we have failed them. And every day you see things on news. But we've been very fortunate in terms of our partnership with the clinical teams across all the 50-odd hospitals. It has been a partnership in action with common purpose and common mission in terms of doing what's right. The clinical teams always identify an unmet need, and then we work together to look at in terms of what is the best solution in terms of addressing that unmet need. And like I said, I sometimes get a WhatsApp message in the middle of the night, and the clinician will say, "Oh, do you think you can do this for us, pal?" And, we obviously have open conversation, but it's about being totally transparent in what we do, but having a common mission and vision, and then working in collaboration to create that impact. Now, we thoroughly enjoy our relationship with all the partners that we work with.
Perfect. Thank you so much. Well, in your own words, what makes Kinseed truly unique and creative?
That's a really good question. Why? Well, I would say we're unique and creative as our mission is to liberate data in motion. It's about how do we break silos. That is, what our core mission is. We prioritize, and what we do every day, day in, day out. It's about building sustainable and future-proof solution. For me, that's really important, as mentioned earlier on. The changes in technology and space that it changes at, we need to make sure that we're able to keep up with that. But more importantly, whatever we design and developed, we focus on collaboration, integration, providing a holistic and interconnected approach to digital transformation. And healthcare needs that. Ultimately, what makes Kinseed unique is our expertise, our approach, and our success in delivering customized and effective solutions, digital solutions that are driven by the unmet need identified by the clinical teams.
Thank you. You mentioned that the whole Kinseed team is constantly working on finding those unmet needs and catering to those unmet needs, and continuously developing the app for the users. So in line with this, what are some new features of the application that are being introduced?
So we've got a lot of new features and functionality coming, and I can't necessarily describe that in this limited time. However, the way we've designed and developed the platform, it provides us with healthcare. It provides the healthcare professionals to really work with their data in an easier, secure, and flexible manner, resulting in faster and joined-up care. For, at the end of the day, their focus should be the patient, not entertaining complex solution. For every department, every clinical teams, every ambulance, every referring, receiving hospital involved in care of a patient needs to access data real time. And what we're doing currently is that we have a number of different clinical devices. If you imagine a patient in a intensive care environment, they could be connected to a number of monitors. So we're trying to work with original equipment providers to work with us to see how we integrate different data, medical devices and data stream into a single place. So we've got a lot of work happening in that area.
Perfect. And I think that brings us really nicely to our final question about the future plans for Kinseed and the future plans for the further integration in the healthcare sector in which the app is currently operating in.
Yeah. So our aim really is to grow in 3 dimensions. We continue to build functionality into the current application, which is Swift Care Suite. This means that better experience, more data type, more automation, and even more opportunity to use the event-driven architecture to connect different applications. That's one of the areas that we're really focusing on. Secondly, we want to continue to build healthcare-focused application to increase number of options available on Swift Care. This may include applications specifically geared towards prescription management, tracking, training, continual healthcare, provider development. Occupational health is a big area. In NHS, we've got 1.3 million people being employed, and they're all burnt out. And diagnostics and other investigatory management system, what we want to be able to do is kind of have that integrated experience. And then finally, for us, Swift Care is built on a powerful generalized engine. So eventually, Swift Core as a concept where we're currently considering is looking to expand beyond sort of healthcare for other areas, because it's all about data. How do we support heavy data-driven industry to be able to collect and share data and use that data to make decisions in a much more effective manner? So we've got our expansion and our strategy, our roadmap that we're currently kind of looking at. So it's an exciting time. We're really looking forward to growing the team and making an impact.
It truly is. Well, thank you so much, Pal, for sharing such insightful information about Kinseed. The whole team at Medtop recognizes the outstanding achievements done by your team. We wish you the best of luck. Thank you so
much. Thank you so much. It's these words mean a lot to me. At the end of the day, we're day in, day out doing what we believe is right. And I'd like to think that in this short period of time, the impact that we've made is huge. And I salute my little team, and I salute the clinical teams who are trying to save lives of not just our current generation, but also our future generation. So thank you for your time.